If you're here to discuss laser vision correction, we start with 4 parameters that we do to decide whether or not you are a good candidate for it. So let's start with the first one. This is the normal cornea, the surface of your eye, the place where we will perform laser surgery. The normal corneal thickness is between 5 and 600 microns, which is a little bit more than a half a millimeter. So we're talking about a very, very thin area. In order to have laser surgery, you need to have enough corneal thickness to safely perform laser surgery. If the cornea is above 500, that's considered normal, and if it's below 500, that's considered abnormal. I will often determine whether or not laser surgery is a possibility for you based on the thickness of your cornea. The second parameter we look at is the curvature of your cornea. Your cornea can be flat or it can be tall, and depending on that will also help us determine whether or not you're a good candidate. The third thing we look at is the prescription. Are you a little nearsighted or are you very nearsighted? And are you farsighted? Those are the things that we look at. And the last thing we look at is your age. So if you're 21, it's different than if you're 41. Because if you're 41, you're approaching the reading glass age, and we have to take that into account. Laser surgery is approved for people over the age of 18, and I'm a great believer that it can be done at that age. Although some people decide to wait until they're into their 20s to have the procedure done. I don't think that that's necessary if your parameters work out. So when you come in to discuss this, we will look at all of these parameters and discuss what is the best option for you. Recently, the FDA approved a procedure called the EVO ICL. And what EVO is an evolved form of an implantable contact lens. And what we do in that situation is we actually make a little incision into the eye and place a contact lens on top of the human lens. It's usually done for more nearsighted people, for instance, somebody who's a -6 or more. But it has been very, very effective. And internationally, where it's been approved for 10 years, there are staggering numbers of people who've had the EVO ICL.